Hi everyone, I'm Angela Chung, a GI specialist physician assistant. Today, I would like to talk about fatty liver. Fatty liver, also called non-alcoholic fatty liver disease or metabolic-associated fatty liver disease, is a common condition in the world. According to the Asian Pacific Association for the Study of the Liver, fatty liver affect nearly a quarter of the global population. Also, the National Institute of Diabetic and Kidney Disease, non-alcoholic fatty liver affect an estimated 80 to 100 million Americans, approximately 25 to 30% of the population. The exact incidence rate of fatty liver in the US is difficult to determine because many people with fatty liver have no symptom and may not be diagnosed. However, studies have shown that the prevalence of fatty liver is increasing in the US, likely due to the rising rates of obesity and type 2 diabetes, which are major risk factors for fatty liver. In addition, fatty liver is more common in specific populations such as Hispanic or Latino ethnicity, people over 50, and those with a history of metabolic syndrome or insulin resistance. Why Asians with low BMI have fatty liver disease? According to the Asian Pacific Association for the Study of the Liver, it has several reasons. Insulin resistance. Asians tend to have a higher risk of insulin resistance even though at lower BMI level, which can lead to the accumulation of fat in the liver. Genetic factors. Some genetic variation has been linked to an increased risk of fatty liver disease in Asians regardless of BMI. Diet. Asian diets are often high in carbohydrates, particularly refined carbohydrates such as white rice and noodle, which can contribute to the development of fatty liver disease. In addition, high fructose intake from sugary drink and snack can also increase the risk of developing fatty liver. Exposed to environmental toxins. Some studies have suggested that exposed to environmental toxins such as arsenic and pesticides may contribute to the development of fatty liver disease in Asians. It is important to note that not all cases of the fatty liver will progress to more serious liver disease, such as cirrhosis and liver cancer. However, early detection and management of fatty liver can help prevent the progression of the disease and reduce the risk of complication. Fatty liver is a condition in which extra fat accumulates in the liver. The accumulation of fats can interfere with liver function and lead to liver damage. Fatty liver can be caused by different reasons, including excessive alcohol consumption is a common cause of fatty liver. The liver metabolizes alcohol, and excessive drinking can overwhelm its processing ability. Obesity is another common cause of fatty liver. Excess weight, particularly around the wrist, can increase the fat in the liver. People with type 2 diabetes are more likely to develop fatty liver because their body processes and stores sugar. High level of triglyceride in the blood can increase the risk of fatty liver. Certain medications, such as corticosteroid and tamoxifen, can increase the risk of fatty liver. The incidence rate of fatty liver disease progression to hepatocellular carcinoma, which is the most common type of liver cancer. However, studies have shown that people with non-alcoholic fatty liver disease are increased risk of developing hepatocellular carcinoma compared to those without non-alcoholic fatty liver disease. It is important to know that while fatty liver disease is a risk factor for the cancer, not all individuals with fatty liver disease will develop cancer. Early detection and treatment of fatty liver disease can help prevent the progressions to the hepatocellular carcinoma. Regular monitoring and screening for the cancer are recommended for individuals with fatty liver disease who are at risk of developing liver cancer. A healthy diet is an important part of managing fatty liver disease. Here are some dietary recommendations that may help improve liver function and reduce liver fat accumulation. Include healthy fats such as omega-3 fatty acid in fish, flaxseed, chia seed, and walnut. Avoid saturated and trans fat in processed food, fried food, and fatty meat. Fiber can help reduce fat in liver and improve insulin sensitivity. Choose high-fiber foods such as whole grain, fruit, vegetable, and legumes. High intake of added sugar has been linked to an increased risk of fatty liver. Limit your intake of sugary drink, sweet, and processed food. Even small amount of alcohol can contribute to liver damage and should be avoided or limited for people with fatty liver disease. Eating large portions can increase weight gain and the risk of fatty liver. Use smaller plates and practice mindful eating to help control portions. Processed food often contain unhealthy fats, add sugar, and salt. Instead, choose whole foods such as fruit, vegetable, whole grain, and lean protein sources. Drinking enough water can help flush toxins from the liver and improve liver function. Aim for at least 8 cups of water per day. Recent studies have shown that bicyclic coagulants have significantly reduced fat in liver accumulation and inflammation. Bicyclic coagulants is a type of probiotic that has been gaining popularity in recent years due to its numerous health benefits. Several studies have suggested that bicyclic coagulants may benefit non-alcoholic fatty liver disease by improving gut microbiome composition and function. A study on rats found that bicyclic coagulant supplementation improved gut microbiome diversity and decreased the severity of liver inflammation in rats while feed a high-fat diet. Another study on humans found that consuming bicyclic coagulants containing yogurt for 8 weeks improved liver enzyme level and insulin resistance in individuals with fatty liver. In addition, omega-3 fatty acids are beneficial in reducing a fatty liver. Studies have found that omega-3 supplement can reduce fatty liver accumulation and inflammation in people with non-alcoholic fatty liver disease. Omega-3 fatty acids are essential fats that are important for maintaining overall health, and they can be found in fish such as salmon, tuna, and mackerel, as well as in fish oil supplement. They are anti-inflammatory property and can help reduce insulin resistance, contributing to the development of a fatty liver. While further research is needed, current evidence suggests that bicyclic coagulants and omega-3 may help potential therapeutic effect for non-alcohol fatty liver disease. By improving gut microbiome composition and function, having anti-inflammatory and antioxidant property. As a GI specialist, I recommend omega-3, bicyclic coagulant supplement, or consuming of probiotic-containing food to my patient with non-alcoholic fatty liver disease. Thank you for watching my video. Please share and subscribe to my channel. See you next time. Bye-bye.